as we get started, I want us to be thinking about the comprehensive school mental health programming in our own schools or districts. And I just want you to think about the programming policies and procedures in your school or district. And just off the top of your head before we get into it, I'd just like to get an idea of where we are in the room. So how would you rate your current practices and policies when it comes to providing comprehensive school mental health for your students? Raise your hand if you would rate your school or district as great. You've been doing this for years. It's really a part of the principles that you strive for, and it's really integrated fully into the school. Okay, I'm not surprised. It's an emerging field, and we're getting there, and hopefully in a couple of years we'll have some people with great, but I'm not surprised. Raise your hand if you would consider your school or district emerging, that you are working on it. Excellent, you're actively working on it. It's in the forefront of your mind. That's awesome. And raise your hand if you would rate it as room to grow. You're not near where you would like to be. Great, but you're working at it still. That's awesome. So I'm not surprised, but that's a really good to know that's where we're at. So just a little bit about my role and the work that I'm doing. Again, I work at the Great Lakes Mental Health Technology Transfer Center. Huge name. We shorten it to MHTTC. Still a long acronym, but we do the best we can. So I work at the Great Lakes Regional Center, and it's part of a national network of centers across the country. It was established in August of 2018 with funding from the Substance Abuse and Mental Health Services Administration, or SAMHSA, and it's comprised of 10 regional centers. Your regional center is, again, the Great Lakes from the University of Wisconsin. We are also partner with and work with a National Hispanic and Latino Center, and we also partner and work with a National American Indian and Alaskan Native Center as well. We have a network coordinating office that helps coordinate all of our national events so that I can focus on the regional and statewide initiatives that we work with. So I just want to talk a little bit about what is technology transfer. When I think of technology, I think of apps and computers. That's not the case in this instance. Technology transfer in this case is information dissemination. So the technology that we're transferring is information. Technology transfer is a cyclical loop of information sharing. It's disseminating and implementing evidence-based practices for the mental health workforce. It starts with the development of new tools, ideas, and programming. It feeds into the dissemination and raising awareness of these tools and ideas. And then it goes through into the beginning stages of implementation and incorporation of these new tools and practices into the workforce. So this is just a map of just to show you that we are all across the United States. And again, your center is located in Wisconsin. I am your contact. My focus is on comprehensive school-based mental health services. And I'm here to support you. I'm here to provide training and technical assistance for the adoption and implementation of comprehensive school mental health. So, to get an idea of what we work on, that can feel a little nebulous. So some of the focus areas that we're currently working on are advancing the school mental health framework, which is what we're going to talk about today. Suicide prevention has been a big need in our communities that we've seen. Trauma-informed care has also come across as a high needs area in the Great Lakes region. And then Tier 1 and universal supports. So these are all in response to the needs that we have seen and have heard from our communities. Some examples of the work we've done, just to give you an idea of maybe how we can also support you all in the work you're doing. We provide training and support, both web-based and in person. So all of our web-based services, everything we do is free, so that's really nice. We're free to work with, and we're really just here to be supportive. We want to ensure that everything we're doing is easily accessible to a lot of people. And so our web-based services are all, they happen live, but if you're not able to access the live conversations, you can access them on our YouTube channel, The Great Lakes Current. So this is just a list of webinars that we currently have available, and this list will continue to grow as we continue to respond to the specific needs in our communities. These are just examples of some of the in-person trainings and learning collaboratives that we have done in the past. Again, just to give you an idea of to get you starting to think about how you may be able to work with us or how we may be able to support the work that you're doing. Last year we did several youth mental health first aid trainings with school safety officers through the Department of Education and with other contacts across the state. And we also are working on implementing strategic change in the state of Wisconsin, utilizing the national curriculum that we'll talk about today. So I just want to we're going to go into now the National School Mental Health Curriculum, Guidance and Best Practices for States, Districts, and Schools. So this flyer, it's available in the back. I also have it at my table I'm exhibiting at the conference, so this is widely available. But this training curriculum is available online for free and contains trainer and participant manuals with slides, worksheets, and other resources referenced in the modules. So it's available, it's out there. And it's accessible for you to use starting today. Dr. Connors is going to pass them out if you would like to take a look at it. And I'm going to show you how to access the training online as well before we get into it. So the curriculum is housed on our mhttcnetwork.org website. This is the page that comes up when you put in the address, and in that middle top where it says resources, if you click on that, a drop down will come down and you'll see school mental health resources. So once you click on that, you'll be brought to this, and this is the opening page for school mental health resources, and the featured resource is the resource we're talking about today. Those two, the purple and the orange, one is the trainer's manual, the other is the participant's manual, and that is where you can access it. So once you click on that, right there, the very bottom, click here. It's going to pull up a registration page. SAMHSA requires us to track not who is accessing our materials, but where. They like to make sure that the information that we're disseminating is widely available. So they're not looking at you, they're really looking at where the information is being utilized, and to make sure that we're filling in the gaps. So you just fill out that information, and once you click submit, down there, another pop-up will come up where you can actually access the curriculum itself. And once you access the curriculum, this is what will pop up. And it's all the modules. It's all 8 modules of the curriculum. And it also has access to additional learning that's happened previously, and so you can learn from the first cohort of people that use the training module and learn from the challenges and the successes that they had. So it's nice that that is also available on there. So I am going to briefly go through Module 1 of the training just to give you an idea and use it as an example of what the training looks like. Each module is meant to be used in a 1-hour in-person time frame, and today we're also going to talk about the SHAPE system, and I wanted to talk about how to access the Mental Health Technology Transfer Center. So we're not going to have time to fully go through Module 1. But you're going to see all the slides that are there, all the training materials that are available to you, even if we don't go through each one of them specifically, and we'll go from there. So we have to go through some of our disclaimers. This work was created by the MHTTC network and the National Center for School Mental Health, and it does not necessarily reflect the official position of the federal government, Department of Health and Human Services, or SAMHSA. And just again, that everything that's available is available for free online and can't be reproduced for a fee. And you are welcome to use it as you see fit. We just ask that you cite it correctly. So getting into the agenda, this is a typical agenda that you'll find in every module. This is the specific one for Module 1, but the agendas are all pretty similar. There's a big, a very specific overview of what you can expect. And this is really laid out so that anybody can pick up the training manual and utilize this to start a conversation within their district teams right off the bat. So you'll see, I'm looking down at notes, the training manuals even come with the speaking points. So you don't even have to think about, well, you need to think about it, right? But you can pick it up and you can use it right away and feel really confident in providing the same work that's happening around the country. So that's really nice that you have the talking points in the training manual so that you can start utilizing this right away in your district teams. So this is the agenda for Module 1. Again, we're not going to have time to go through everything in depth, but we will breeze through all of it so you can at least see what everything looks like. So as I mentioned, this curriculum was developed between the MHTTC network and the National Center for School Mental Health. We already talked about the MHTTC network, but here's another introduction to it. And then the National Center for School Mental Health is housed at the University of Maryland School of Medicine, and it's funded by the Health Resources and Services Administration, or HRSA, and they are charged to lead the National Quality Initiative focused on comprehensive school mental health services. Their mission is to strengthen policies and programs in school mental health to improve learning and promote success for America's youth. And they focus on advancing school mental health research, training, policy, and practice at the local, state, and national levels. So as part of Module 1 is the curriculum overview. So these are the 8 modules that I keep referencing. They're each designed to be individual and each designed to be displayed or utilized in 1 hour training. 1 hour team meetings or training sessions. So for example, if your school was really interested in advancing their screening policies and their screening practices, you could pull out Module 4 screening and just do that one in a 1 hour team meeting or in a 1 hour district meeting. And so you don't have to start from 1 and go all the way through 8. You can really pick and choose what's most important to you. Again, it includes trainer and participant manuals, including all the slides, all the notes, worksheets, and other resources that are available. The target audience for this training curriculum is really district teams that can influence, develop, and oversee school mental health systems at school, district, and building levels. Teams may include district leaders, administrators, district mental health supervisors, community mental health providers, and then youth and families advocates or consumers. So it's really meant to be used to bring strategic change to the district and school level. In each of the modules, we talk about quality indicators and best practices. We're going to talk a little bit more about this at the end when Dr. Connors comes up to talk about the SHAPE system. But each module does align with the national performance domains and indicators of comprehensive school mental health system quality in the National School Mental Health Quality Assessment. So they're all aligned with that as well. And again, Dr. Connors is going to talk more about that. So we're not going to overview this now, but we will in a little bit. So let's define comprehensive school mental health so that we're all on the same page as we continue our discussion. I know this is heavy wording, and I am going to read it just because this is the meat of what we're doing, and I want to ensure that we are all coming at this from the same lens. Comprehensive school mental health systems provide a full array of supports and services that promote positive school climate, social emotional learning, mental health, and well-being while reducing the prevalence and severity of mental illness. Comprehensive school mental health systems are built on a strong foundation of district and school professionals, including administrators and educators, specialized instructional support personnel, in strategic partnership with students, families, and community health and mental health partners. These systems also assess and address the social and environmental factors that affect mental health, including public policies and social norms that shape the mental health outcomes. Effective, comprehensive school mental health systems contribute to improved student and school outcomes, including greater academic success, reduced exclusionary discipline practices, improved school climate and safety, and enhanced student social, emotional, behavioral functioning. Whew, that's a lot, right? That's heavy, but this is what we strive for. This is the gold standard of what comprehensive school mental health is in schools. None of us are there yet, and that's okay, but this gives us something to look towards. So some of the core features of comprehensive school mental health systems are these listed, and in this module, in the training curriculum, it goes through each of these core features in depth, and it gives you the opportunity to think about each of these core features and how it relates to your school, how it relates to your current practices, and where the benefits would be to enhance or improve them. We are not going to be able to go through these in depth, but I did want to point out that these are the core features. So what the module will go through, and we'll breeze through so you can see what it looks like. But the core features include educators and student instructional support personnel, collaboration and teaming, multi-tiered systems of support, evidence-informed services and supports, and cultural responsiveness and equity, and data-driven decision-making. These are the features we want to keep in mind when we are implementing and growing our comprehensive school mental health systems. So the next several slides, as I said, go through in depth on all the core features of comprehensive school mental health. We're not going to go through them individually because I want to make sure we have enough time for everything else we want to accomplish today. But I just want you to see a brief visual representation of how in depth and how much information is available for guiding your future conversations. So this, again, goes through the core value of educators and student instructional support personnel. Another core feature is collaboration and teaming. Some examples of partnership that are included in collaboration and teaming. This goes beyond the school walls and really to utilizing additional services as well, including community partnerships. Starting to have the conversations of who are we utilizing outside of our school walls, what's working, what's not working, how can we augment the services we're able to provide from school personnel, and how can we utilize the supports that are out there so that we can provide larger and broader array of supports. Now, I know that a focus of this conference is the multi-tiered system of supports and how to ensure that this is embedded in your school practices. And I just wanted to point out that this is a key factor, a key feature of the national curriculum as well. It's really important to have a full array of tiered, evidence-based processes, policies, and practices to promote mental health and reduce the prevalence and severity of mental illness. It's based on the principles of prevention, and the tiers of support layers layer on top of one another so that students with higher levels of needs continue to receive all the supports below. go. So as you're going through your time and over the next 2 days, I know this is a key piece of what you'll be doing and integrating in the work you're doing, and just know it's integrated in the work we're doing too. So it's a nice partnership with everything that's going on in the next couple days. So these are just the key considerations that we talked about. Another key core feature is evidence-informed supports. We want to ensure that that the work that we're doing is evidence-based and that we're strategic in the work that we're doing. We want to ensure that the services are backed by scientific or practice-based research, and that there are teams in place to evaluate the work we're doing as well. Some sources of evidence to consider when you're looking at this are registries, literature, et cetera. And we just want to ensure, again, that the work we're doing is strategic. So another core feature that is really important to the national curriculum is cultural responsiveness and equity. We want to ensure that the work we're doing is available and accessible to all students. And it's important that in all aspects of comprehensive school mental health, it is critical to consider and be responsive to the specific cultural values, beliefs, and behaviors of the families and communities that you serve, and ensure access to mental health supports and services in a manner that's equitable to all students. Again, equity is a main key feature, core feature in the comprehensive school mental health curriculum. And again, we just want to ensure that we are utilizing support and thinking about how our supports serve our whole student body as a whole, and key into the different needs of different students that may be in our schools. So the last core feature is data-driven decision-making. Again, we want to ensure not only that the work that we're bringing in is driven by data, but that the work we're doing and the work that we're choosing to continue or maybe end is also driven by the data. We want to ensure that what we're doing is working, and we want to ensure that our resources are being utilized to the best way that they can be. So I know that was really fast to go through the core features, and I wish we had more time together to do that, to go more in depth, but unfortunately we don't. This is just a part where I just want to pause and think about, I know we didn't go over the core features in depth, but I just want you to think a little bit about which core features that we have talked about is your district doing well or thorough? Which core features do you wish were more consistently present in your schools? And I think this last question, I think, may be the most valuable one to consider, is how do you think families would respond to the question of which core features are the school or district doing well or doing not so well? I think we can learn a lot of information from our families, and it's really important that we have their voice and their considerations in mind as we're moving forward. So this is a key piece of all the modules in the training aspect, these reflection points. We want to make sure that while we're training or while we're having these conversations, that we're taking the information that we're learning and training on and bringing it back to the specific work we're doing within our schools, districts, and with our specific students. So this is really important that we continue to have these reflection points and utilize them to guide conversation to begin the strategic planning process to move comprehensive school mental health forward. So I breezed through all of that because I think it's really important that we do discuss the value of comprehensive school mental health. We all know it's important. I didn't know why it was important until I started diving into this. I knew why it was important, but I didn't have the data to back up why it was important. And the data is out there to show that there is so much value in promoting comprehensive school mental health. So when we think about mental health, I just want you to think about your graduating class or your class that will be moving on to the next grade level, and what is one skill you wish all graduating students possess? And we're small enough. If you want to raise your hand, if you think about what's one skill would you wish for all of your graduating students to possess? Self-regulation. Self-regulation. Problem solving. Critical thinking. Awesome. So none of that was finding the hypotenuse, right? None of that was when was the War of 1812. All important, but it's, it is what it is. So that is what we always find, is that although there's great emphasis on academic skills in school, when asked about the skills that are important for graduating students, most people identify social-emotional competencies as a priority. This wheel is the social-emotional learning wheel from CASEL, the Collaborative for Academic, Social, and Emotional Learning. And it reflects the 5 domains of social emotional learning: self-management, self-awareness, responsible decision-making, relationship skills, and social awareness. The answers we got today all touch these, right? And so this is really the crux of what we want our students to come away with when they're done with their time with us in their schools. And we can do that, and we can provide that by implementing comprehensive school mental health services and supports in our schools. So these are just 2 very, very important statistics to think about. Schools are the primary mental health service provider for children. 60 to 80% of children who receive mental health services do so in their schools. And 20% of students receive some form of school mental health services annually. So just to drive home the impact of student mental health, school mental health matters. There's growing data to support the accessibility and impact of school mental health. Students who participate in social emotional learning programs do better academically and socially than those who don't. Positive school climate and social emotional learning improves school safety and decreases bullying. And youth are 6 times more likely to complete complete mental health treatment in schools than any other community setting. So again, school mental health outcomes, these are all outcomes that we've talked about. It's just really important that these are the positive benefits that come from having access to comprehensive school mental health programs and policies in schools. And it's really what we want to keep in mind when we are advancing the mental health services we are providing to our students. So if all of this feels overwhelming, or if all of this feels like, how do we do this? Where do we go from here? Is this even possible? The nice thing about the curriculum is at the end of each of the modules, there are district and state examples that show people that are already doing this well, and you can learn from them and steal from them and take from them, and so that you're not starting from scratch. There's no reason to start on your own trying to do this when there are already resources and examples of where this is happening and where it's going well. So we won't go into all of these examples, but I just want to highlight that they're there, and they're there to be learned from. This is a district example from Boston and their comprehensive behavioral health model. This is the Wisconsin School Mental Health Initiative. This is a statewide mental health framework. I know the folks who wrote this, and they always say steal away, because they worked really hard on it and they borrowed from everyone they could find, and they want you to do the same. So if you're feeling like that feels weird, start with Wisconsin's, because I've got it on good authority that they're really looking for you all to be utilizing the framework that they've already put out. And they took it not directly, but they took a lot of their ideas from Colorado. Colorado was one of the first states to implement a statewide mental health toolkit, and Wisconsin learned a lot from them. So at the end of every module, it wraps up with a discussion and strategic planning. All of these questions are the same in each module, and it's really important to think about moving forward after you leave the room, after you leave the 1-hour session. State one specific goal for your district related to the module, and so for this case, related to comprehensive school mental health. One specific goal that is tangible, that is reasonable, that is measurable, and then list 3 potential action steps to move towards this goal. And these are small steps. These aren't giant leaps. We're looking at what's attainable, what's achievable, so that we can move forward at an appropriate pace, so that it is that we're able to continue to grow and that it doesn't stall because we moved too fast. So again, at the end of all of the modules, there's huge lists of resources and tools. That's really nice. There's worksheets included, so that you don't have to start the conversations from scratch. You don't have to start the work from scratch. So even if you don't use a module, a training module like I just did front to back, you can still access the resources and utilize the tools and start conversations from there. So it's really nice that you're able to really just pick the pieces and take the pieces that are most important to you and utilize them from the beginning. Are there any questions on the curriculum itself before we move into the SHAPE system and the national indicators? Or the regional center. So we'll have Dr. Elizabeth Connors come up. She helped create this, and she helped create the SHAPE system, so we're really fortunate to have her here.
So yeah, let it percolate. For a lot of people, the idea that a curriculum like this is out there is new, so you might be thinking through how you would actually use it. And what we're finding is that there really are a variety of ways that it can be used. It was developed, as Sarah said, to be something that's kind of a district level train the trainer. That's how SAMHSA funded us to develop it, envisioning that state leaders, for example, might deploy coaches to go out, from districts to train other districts to advance their comprehensive school mental health systems. And now that the curriculum's been out for almost a year now, we're finding people are using it in different ways. And sometimes it's just exactly as Sarah described. Like maybe you just want to dig in there for your own team and go through the resources or go through one of the modules in a team meeting. It's designed to be flexible and kind of self-directed, and it's there for you. So what I'm going to do now is actually tell you a little bit about the SHAPE system. And the reason that this is so important is because sometimes people don't always realize that the comprehensive school mental health curriculum that Sarah just introduced you to was developed completely in partnership with the school mental health quality assessment and all of the resources on the SHAPE system. So these resources are completely complementary by design, and so if you're interested in using some or all of the school mental health curriculum, we also encourage you to sign up and engage with the SHAPE system for a number of reasons. There are ways for you to go in and kind of self-assess in a more systematic way how your team is doing on each of these areas. The resources have kind of more interactive ways to filter and sift through them. So they're kind of these two complementary resources that are helpful to know about in tandem. So what I have here is a series of screenshots that lead you through kind of what the SHAPE system is and how to sign up for it. What I'm going to do is just take you through a couple so you know what SHAPE is, and then I'm actually just going to show you the system live. I've got it pulled up and I'm logged in, so I can show you what it looks like to be in an account, and we can kind of talk about some of the features. How many of you have heard about the SHAPE system before? Oh, fantastic. How many of you have actually gone in and used the SHAPE system, like have an account? Oh, great. Okay, so not maybe news to everybody, but certainly to some people. Okay, so the SHAPE system, and I'll say from the beginning too, everything on SHAPE is free, SHAPE itself is free, and it always will be, as we like to say. So this is federally funded, mostly from the Health Resources and Services Administration, was developed by the National Center for School Mental Health, and originally was designed to be a free web-based portal where teams could go in and self-assess the quality of their school mental health system on these performance metrics. And what's happened over time is SHAPE has kind of evolved, and we've learned that it can be used for a lot of different reasons, and we've built on some additional features. So the gist of it is that it offers a free web-based platform to teams to go in and self-assess comprehensive school mental health, and then work through different strategies to improve whatever it is you've prioritized as a team. What we know from talking to schools and districts who are working to advance comprehensive school mental health is, it's big to bite off the whole, right? There's a lot of aspects of different things we could lean into and tweak in our systems, and no one team can take it all on in 1 year or even 2 years. Often what busy teams need is a strategic way to go in and really take kind of a comprehensive stock of what's going on in their system, and then make some informed decisions about where they want to prioritize their efforts in the short term and then in the long term. So some of the features that are highlighted about SHAPE, which you can find on the homepage, is that SHAPE users map their school mental health services and support, so you know what it is that you have, right? Sometimes that's half the battle, is kind of getting your arms around what it is that you offer comprehensively. And then assessing how high quality your system is, how comprehensive it is using these national performance standards. And then there's custom reports and strategic planning guidance and resources to take you a step beyond. So this is not just an assessment process where you send the data into a black hole, but rather it's information that comes out to you immediately and kind of guides you along the way to make improvements. There's additional SHAPE features. There's a screening and assessment library I'll show you where you can find free or low-cost screening and assessment tools. There's also a trauma-responsive schools implementation assessment. So if that's a big priority for your team, is learning how to become more trauma-responsive and all of the many facets of that term, there's also an assessment tool and resource library on SHAPE for trauma responsiveness as well. And then we also offer within SHAPE ways for teams at different levels to engage and collaborate. So we have state level dashboards, we have district accounts, school accounts, and now we even have individual accounts for folks who want to go in, poke around, learn a bit, may not be connected to a formal team. Okay, so you can find all of these SHAPE features on the website, so I'm not going to overly read to you, but it kind of goes through these different features. So there's school and district profiles where you can collect information as a team and then gather a snapshot about what your school or district offers. There's the quality assessment and resources, which I'll show you, as well as the state and district dashboard I mentioned, and then those 2 extra features, the screening and assessment library and the trauma responsive schools self-assessment. So by the way, this is at theshapesystem.com. So if anybody has your mobile device, we have great Wi-Fi in here. Feel free to go there and poke around while I'm talking. But at this point, instead of going through all my screenshots about creating a SHAPE account, I just want to show you the system. So Indiana is one of the states that has really championed the SHAPE system for a long time as part of their efforts to support systematic school mental health quality. The Department of Education and Mental Health here has really leveraged the SHAPE system to support school and district teams across the country in figuring out their areas to grow. So I know I can't keep it from shifting. Isn't that cool? But this is actually a feature right on the homepage that we've done a SHAPE spotlight for how Indiana has really adopted SHAPE throughout the state, which is super exciting. All right, let me log in here. You guys get to see all the... So once you have a SHAPE login, you can log in just like me. And it's going to land me on a demonstration account. So this is what it would look like if you were, and this is a district account. So let's pretend I was a district team member and this is the only account I have. And you can be involved in multiple SHAPE accounts. Some people, for example, if you're a school psychologist, the likelihood is in most states you're going to be part of more than one school team, right? You're going to be kind of popping in and out all over. The same thing with our district leaders. Sometimes they're involved in a number of school teams as well as at their district level. So you can be as part of as many SHAPE teams as you wish, and you can kind of toggle back and forth in the My Account feature. But it will land you on the last account that you are in by default. So this is what it looks like. And so you can see Jefferson United is the name of the team in the upper left here. And then it lands you on this overview tab. And so this was something that, so by the way, the SHAPE system was just released onto a new platform and a new look and feel as of September 2019. So prior to this, there was a previous site, some of you that have been using SHAPE for a number of years may be more familiar with. So there's some kind of updates to the system. And one of the things that we heard people really wanted us to do is just provide an overall kind of summary tab that explains what all these different pieces are, which I explained to you. And then across the top, you can see the tabs where you can go to all the different places. This star status here in the upper right is your certificate, so it basically reflects how many different things you've done within SHAPE. We heard from a lot of teams and stakeholders that it's important that we have ways to recognize and show and share the work that we've done when we are particularly committed to school mental health quality. So we've heard of schools and districts, for example, including their star status certificate when they apply to the state for funds to receive a grant for something, right? So this shows that as a team, we're really committed to comprehensive school mental health, and we have this gold level SHAPE recognition. So people have used this for different things. So I'm going to take you over to the school mental health profile. We recommend that this should be one of the first things you do when you go into the system. This is where you kind of gather that snapshot of what you have going on in your school mental health system. This in and of itself can be really beneficial if you haven't had a chance to sit down and talk with everybody else on your team about your data systems, the students you're serving, your staffing array, you know, what school employed and community employed personnel do you have as part of your system, and what kind of services and supports you offer at all three of those tiers. So in many ways, this is kind of a first step to understand, like, what are we working with, right? And so these are the three sections of this school mental health profile. When you log in, your school on the upper right will be all gray, and then as you complete each section, it highlights in yellow. So you can see this is an account where they've completed all three sections. And when you take the survey, it's pretty simple. You just go through, and it's just like any other questionnaire, and it describes the question. So the first one here is, does your district have an electronic data system to identify the number of students receiving mental health early intervention, tier 2 and tier 3 supports? Yes or no, right? And actually, it looks like this is taking us toward the end. These are some of the earlier questions. It asks for these different services and supports. Remember, this is a district questionnaire. You know, to what degree are these available in all of your schools? You know, so you might be offering tier 3 services and supports, but how many of your schools are really providing that at this time? So the questions are slightly different for the district and the school, because the school team, it's asking them to say what is being provided in your school building. For the district questions, it's asking you to think more about what's happening throughout all of your schools, which we know can vary quite a bit depending on how big your district is and kind of the level of heterogeneity in your district or region. So it's just a questionnaire that you would go through as a team. You can save and return at any point. You can print it out. You can get the printable version here. A lot of teams like to get the printable version, look at it, go through it, sometimes divvy it up, email it out to your team members before you meet. I've seen some teams where they actually assign sections to different point people that they think will know best about those sections. Other times teams say just scan through it and let's talk about it when we meet. Ultimately, one person goes back in and enters the information into the system. But looking at the printed version first is usually helpful for most teams. A lot of us still like to work with paper and pencil in the moment in those team meetings, even though we kind of have this nice slick system to go enter it into electronically. And then, so there's instructions for the school mental health profile, a printable version, and a sample report, so you can see what it'll look like at the end. And people, again, use this for all kinds of different purposes. It's not only for internal documentation, but often also for external sharing with stakeholders as a communication tool. It can help you advocate for what you need more of or what you need more support with. I like this. There's one at the end that's nice. It's like, this is what your triangle looks like and all the different types of issues that your services and supports provide. So you can always pull up sample reports. And you get that through going through the summary report. So I took a moment to show you that because after you do your school mental health profile, the next step is going to the school mental health quality assessment. And it works exactly the same way as I just showed you. So when you first go to the quality assessment, so let's say you finish the profile, you have a sense of what you're offering right now, and it's time to think about the quality of your performance in all of those domains that Sarah mentioned that are in the curriculum, right? So it's time to think about how are we doing with respect to teaming, with needs assessment and resource mapping, mental health screening processes and practices, Tier 1 services and supports, Tier 2 and 3, funding and sustainability and impact, right? So you can see how we've moved from just describing what we have in our system to now what's kind of our level of performance and quality in each of these areas. So it works the same way in that when you log in, that house will be all gray. And as you complete each section, you'll see it light up with different orange slices. So you kind of get a sense of how many parts of that quality assessment you've done. You do not have to start with teaming. You do not have to complete them all at once. You can go in and do a series of questions for one section and look at that summary report and then go on to another section. This was something that was requested really strongly by the field and stakeholders who we talked with when we did the newer version of SHAPE, is they wanted it to be modular. They wanted to be able to break down this assessment in a kind of bite-sized chunks so that it could be even more self-directed. And you can decide as a team how you want to take this on and divide this up. So let's pretend you want to go into teaming first. You can adjust your reporting period at any point. It does default to the previous school year, but you can change that up if you wish. At the beginning, it'll give you a description of what do we mean by this title. So in this case, it's teaming. What do we mean by teaming? It'll give you a little bit of a definition to kind of ground yourself in that. And then there are several follow-up questions. There's about 4 to 8 questions in every section. And so most of them are kind of on this continuum of response where it's not really entering, numbers of students that have received services necessarily, although there are some of those kinds of questions in the impact domain. The vast majority of questions are like, to what extent are you doing insert best practice here? And then you decide as a team where you fall on that continuum. So this question says, to what extent did schools in your district use best practices to ensure their school mental health teams were multidisciplinary? So how multidisciplinary are the teams in those schools that you're overseeing? And it goes all the way from a 1, so our school mental health teams did not have multidisciplinary engagement. There might be individuals of only one group who are on their school mental health teams. All the way to like the highest response was that the school mental health teams in our district consistently include representatives of 6 different groups, including representation of youth, families, school and community employed health and mental health providers, community leaders, teachers, and school administrators. If anybody has a district where all of those groups are represented in all of your schools, please call me and I want to talk to you because I think that would be awesome. And I say that just to highlight that the 6s are like out there, guys, okay? So they're definitely, some of them feel a little arm's length. Don't let that, get you tripped up when you're answering these questions. But the goal is, as Sarah said, we want to be moving toward this gold standard in as many areas as we can, depending on what your team prioritizes. So let's say as you go through the teaming module, and then you reflect and say, that multidisciplinary teaming question, I keep thinking about that. I think I think that's where we should start. I think if we had more multidisciplinary representation in our schools, we could get a lot more good work done in the area of equity or provision or services or whatever it is, okay? So you select it, there's a list of best practices below, and you go on. Sometimes it's on this continuum of never to always. So what you'll realize in this is if you're doing this as a team, you kind of need to have some consensus conversations, right? And you're going to have different perspectives in the room about some of these responses. Some are a little bit more subjective than others, and that is by design. It's designed to structure team conversations so that you are sharing information about these key aspects of quality and having those conversations as a team so that you can work more toward prioritizing some shared common goals for quality improvement. You could also go in, the new system does allow you to go in as individuals. Sometimes teams that are really into data ask this question, so we made it possible. You can go in as individuals and all submit your individual responses and then pull it together in one report. If you really want like a mathematical average of everybody, feel free to do that. At the end of the day, you're still going to have conversations about those discrepancies to make change as a team, right? And set those priorities as a team. But just know that that flexibility is there for you. So that's the quality assessment. It's these 7 sections. You know, the school mental health curriculum has 8 because it has that foundations module that Sarah showed you that kind of gives you that big picture. But when you get into kind of the meat of the, you know, domains of school mental health quality, it's these 7 sections. And you can pull a sample report, printable version of this to take a look at it. If you did all the sections, this is what your summary report would look like. If you just did 1 or 2, it would only include information from what you put in. But you can see the cover page here has your reporting period, the date of the report, how many users entered this information, and then it shows, and notice I've got none up in mastery, right? Because that's like real world. But probably most of your scores are going to be in that progressing and emerging range, and then screening is in your other performance domains. So it kind of shows you where the scores shook out, and then there's a page for each section, 2 pages actually, and it will show you kind of if you want to compare item to item how you were doing on those different ones. So it looks like here actually we were really concerned about multidisciplinary teams, but it turns out that we're doing better in that area than some of the other areas. It might actually be that avoiding duplication and promoting efficiency, maybe we should start there first. But I don't know. That's the debate for your team to have when you look at your scores, right? And if you need help figuring out how to narrow this down after you've done the assessment to where you go next, at the end, there is a strategic action planning guide that you can use to facilitate your conversations, where you think about, what are the top 3 domains or sections that you scored the lowest, and then kind of walking through evaluating how to whittle it down to 1, and then going from there to specific goals and indicators of success. So some teams like this structure, some teams rather do their own thing, whatever works for you. So I'm just going to quickly show you just these other tabs, and then I will stop so that we can take a couple minutes of questions. After you've done the sections or before, you'll want to go to the resources tab, because let's say you want to know everything about teaming resources. You can filter in this resource library for anything related to teaming, or anything related to your partners in teaming, or anything related to your structures or processes. And there's tons of free resources here that have been vetted by the National Center and uploaded and updated for you. So this resource library exists for all 7 sections of the assessment I just showed you. There's also this trauma responsiveness one, which I think is really slick. There's more domains of trauma responsiveness than I ever knew existed, guys. This was developed in collaboration with the NCTSN and the Treatment Services and Adaptation Center, so it's there for you. There's a screening and assessment library, as I mentioned, where you can search for different screening and assessment tools depending on what you're looking for. This, again, this is going to look the same. So if you wanted to do this TRS assessment, you've got the 8 sections of trauma responsiveness. the way the system works is the same. So as you're kind of doing the different tabs, you're getting the hang of how the system works. It should be pretty intuitive. As a district, you can view your school's information if they share data sharing with you. And you can always go to your school or district account page to make changes and kind of levels of access, invite new team members so they'll get an email to join your page. Okay? So with that, I'm sure there's many things I've left unanswered, but that's kind of the high and low of it. So what questions do you have about the SHAPE system? I think it would be a lot to go through the entire school mental health curriculum. Do you agree, Sarah? So what I would recommend is, let's say there's one area of the curriculum you know you want to do. I would maybe check out the curriculum first, but then go to that section on SHAPE to do your actual self-assessment and see what you want to improve. If you want to really get a sense of how your whole system is doing, I would just go right to the quality assessment on SHAPE, see where your strengths and needs are, and use that to say, okay, now which curriculum module are we going to pluck? Does that make sense?
Yes.
Okay.
First.
Yep. I mean, it's self-directed, so the answer is kind of whatever you think makes sense. That's a good question. So you would love the screening section of the quality assessment and of the curriculum, because that's where you're going to find all of the implementation nitty-gritty about mental health screening. Also, shameless plug, I have a presentation tomorrow morning going through the screening curriculum and actually talking about how we deal with that. And so if you have implementation questions about mental health screening, go to the quality assessment and the curriculum, right? But this is just helping you pluck a tool that you want, and you could be doing that from an informed perspective or not. But if you wanted to find one, basically, then you could find out more information about it. Now, there are some, for example, when you select screening as a focus area, there are some that won't come up. So for example, the youth mania scale, let's give an extreme example, is not going to come up when we select that our focus is screening. So we've already done a little bit of filtering within that. So things that come up for screening truly are things you could use as a screening tool, and they wouldn't be more kind of symptom specific.
Okay.
Yeah. Okay, so with that, I know we're wrapping up our session. I know Sarah and I are around for a couple of moments if you want to come up and talk with us or ask any additional questions, and we'll also be here for the next couple of days, so we look forward to connecting with you. Thank you for your attention and participation.